My son called from the hospital. Dad, the doctor is refusing to treat me and says I'm faking my symptoms for drugs. When I arrived at the ER, the doctor's smug expression disappeared, and he whispered, Chief of Surgery, I didn't realize he was your son. The call came at 3:47 a.m., Friday morning. I was reviewing surgical schedules for the upcoming week. My son Ethan's name flashed on my phone screen. My chest immediately tightened. Ethan was 22, grad student at State University 3 hours away. He never called at this hour unless something was seriously wrong. Dad, I'm at Mercy General's ER. His voice was strained, tight with pain. I've been here for 2 hours. The doctor won't treat me. He keeps saying I'm faking my symptoms to get painkillers. Dad, something's really wrong. It hurts so bad I can barely stand. I was already grabbing my keys. What symptoms? Tell me exactly what you're feeling. He took a shaky breath. Started around midnight. Sharp pain in my lower right abdomen. It's gotten worse every hour. I'm nauseous. Threw up twice. I have a fever. I tried to explain my symptoms, but the doctor just kept asking about my drug history, looking at me like I'm some junkie. My hands went cold. Lower right quadrant pain, nausea, vomiting, fever. Classic appendicitis presentation. If it was appendicitis and they weren't treating him, his appendix could rupture. That meant sepsis, peritonitis, potential death. Who's the attending physician? I demanded. Dr. Vance. Dr. Leonard Vance. He won't even examine me properly. Did this quick palpation. Barely touched my abdomen. Then told the nurse to give me Tylenol and discharge me. I was already in my car, backing out of the driveway. Don't let them discharge you. Tell them your father is Dr. Garrison Mills, Chief of Surgery at St. Catherine's Hospital, and I'm on my way. I'd been Chief of Surgery at St. Catherine's 8 years, General Surgeon for 23 years before that. I'd seen every complication, every delayed diagnosis, every case of medical negligence that ended in tragedy, and one thing that made my blood boil: doctors letting their biases override clinical judgment. Young male patients presenting with abdominal pain were often dismissed as drug seekers, especially if they had tattoos, piercings, looked like they might use recreational substances. Ethan had both arms sleeved with tattoos, wore his hair long, had a nose ring. He looked like the stereotype lazy doctors used to justify not doing their jobs, but Ethan was brilliant, kind, had never touched hard drugs. He was finishing his master's in environmental science, spent weekends volunteering at wildlife rehabilitation centers. The idea that some arrogant ER doctor had taken one look at my son and decided he was a drug addict without doing proper diagnostic work made me want to put my fist through something. The drive to Mercy General took 2 hours 38 minutes. I spent the entire time on the phone, first with Ethan to keep him calm, monitor his symptoms, then with colleagues to gather information about Dr. Leonard Vance. What I learned made my stomach turn. Vance was 46, ER physician for 15 years, multiple complaints filed against him, patients claiming he'd dismissed their symptoms, provided inadequate care, nothing had stuck. Hospital administration kept settling complaints quietly. Medical board never pursued formal investigation. He had a reputation among nurses, dismissive, arrogant, quick to label patients as drug seekers without proper assessment. By the time I pulled into Mercy General's parking lot at 6:31 a.m., Ethan had been in the ER nearly 5 hours without treatment, 5 hours with potential appendicitis, 5 hours during which his appendix could have ruptured. I walked through those ER doors with my hospital ID badge visible, my fury carefully controlled. I found Ethan in a curtained area, looking pale and sweaty, curled on his side on the gurney. A nurse was checking his vitals. She looked worried. I did a gentle palpation of his abdomen. The moment I touched the right lower quadrant, he nearly came off the table. Rebound, tenderness, guarding, fever, 5-hour history of progressive pain. This wasn't just appendicitis. This was likely a ruptured appendix. Where's Dr. Vance? My voice came out colder than I'd intended. The nurse hesitated. He's with another patient. Room 4. I pulled back the curtain, walked straight to room 4. Through the open doorway, I could see a man in his mid-40s, wearing scrubs and a white coat, laughing with another physician while reviewing a chart. He had the casual arrogance of someone who'd never faced real consequences. Dr. Vance, he turned, expression still amused. Yes? Are you a family member? I'm Dr. Garrison Mills, Chief of Surgery at St. Catherine's Hospital. I watched his face change. Full story is linked below or on my channel.